All right, well, let's go ahead and get started. Good afternoon, everyone. This is Melissa Cotrese. I'm the CEO of Health Current. You are going to be hearing from me as well as Jamie Pena, our Manager of Recruitment and Engagement, during today's presentation. Our Chief Business Development Officer, Christy Dye, is sorry she's not able to present today. But I'm stepping in her place today, and she actually may even be on the line. Just has a bit of a scratchy throat and wasn't able to actually present. So I'm just going to do a brief introduction here, and then I'm going to turn it over to Jamie, who's going to give you some specifics on the DAP CYE 2022 requirements for behavioral health outpatient facilities, integrated clinics, and nursing facilities, and then I will chime in with some additional information on data quality throughout the presentation. So we appreciate you attending the second of two webinars that we have hosted on the new DAP requirements. This, as I just mentioned, this one is focused on behavioral health, integrated clinics, and nursing facilities. I am joined today, in addition to Jamie Pena, we have Caitlin Nguyen on the phone, who's our Director of Client Services, and she'll be available. She works very regularly on the DAP program with our various participants, and she'll be available for any other specific questions that may come in the chat. So we're looking forward to providing you with detailed information about this coming year's DAP program, including eligibility to participate, the incentives that are available for your facilities, the specific HIE milestones and requirements in the HIE quality improvement portion. We should note that we are presenting specifically on the HIE requirements for the differential adjusted payment program that Access has. So as the HIE, that's the portion that we're speaking on today. We do recognize there's other aspects of the differential adjusted payment program. And if you have questions on those, we are happy to direct you to the right person at Access, but we're really only able to speak in detail to the HIE related requirements. We are planning to leave about 10 to 15 minutes at the end to answer any questions. So if you've got those questions, please enter those in the chat box. And if needed at the end, we can unmute lines if you raise your hand and take questions verbally, but we, as Christine already mentioned, we are keeping all lines on mute to minimize background noise. We are also planning to post a frequently asked questions document on our website at the end of this session. So with that, let's go ahead and go to the next slide, and I am going to turn it over to Jamie to lead us through the first section of this presentation. Jamie?
Thank you, Melissa. And thank you all for attending today. And as Melissa mentioned, as we get going, if you have questions and things, feel free to just put those in the chat box. And when we get to a point where we can answer some of those or towards the end of the webinar, then we will go through those. Go ahead and go to the next slide there, Christine, please. Okay, so our agenda for today, the first thing we'll be going through are the DAP Basics, the letter of intent submission process, the DAP HIE requirements, the data quality and strategy from Health Current as well as DAP, and then Health Current versus our participants. What are the roles and responsibilities as far as the expectations when it comes to DAP? And then again, at the end, we will have time for those questions and answers. So the purpose of this webinar is to clarify the Health Information Exchange, the HIE requirements of the differential adjusted payment program for those eligible providers. The HIE participant entities covered in this webinar are specific to the behavioral health outpatient clinics, integrated clinics, and nursing facilities. We did cover the other provider types in last week's webinar. So if you chose to join this one and actually needed information in regards to the inpatient settings, we do have that recording up on the Health Current website as well. So getting into the DAP Basics, what is the DAP program? So most of you in the past have had some form of DAP requirements, the Differential Adjusted Payment Program in the past. So this year, if you are on this webinar, you likely have an HIE component to that. And so the DAP really is to distinguish providers that have committed to supporting and designated actions and improving patients' care and reducing that cost of care. And so the DAP program is an integral part to the HIE, or to having HIE data and connectivity. So while we recognize, as Melissa mentioned, that there are several other components to the DAP program, as mentioned here on the bullet points, UTI performance measures, quality reporting and awards, et cetera, this will be specific to those HIE requirements. So anything HIE related in DAP, certainly this is the place to be. Go ahead and go to the next slide there. So the differential adjusted payment is a means for access to offer and pay incentives to its provider network based on meeting the various requirements as part of Access's broader value-based strategy. The HIE requirements have been a key component of DAP policies over the years, this beginning in contract year in 2017. And so we are currently talking about contract year ending in 2022. So going from October 1, 2021 to September 30th, 2022. So we'll be going through those different requirements. But again, if you've already been a part of DAP, if you were part of DAP with the behavioral health and integrated clinics, you may be familiar with some of this information. So hang tight with us till we get to the meat of the milestones for this year. Go ahead and go to the next slide. So the DAP preliminary notice was posted on the Access website on January 29th of this year. There was a small revision released on February 3rd. So if you haven't had a chance to go and take a look at that, we are providing the web URL for you to visit that information. Public comments are accepted through February 26th. So if you've got just under 2 days here, if you have any remarks that you would like to make to Access, the final public notice will be published around March 26th timeframe. So until then, we will have several alerts and communications from Health Current in regards to DAP going to all the eligible provider types. Go ahead, next slide. So this is a look at the table that we created in regards to all the eligible provider types for CYE 2022. As well as the HIE incentive that was proposed for the DAP program. So for today's purposes, looking at the behavioral health outpatient clinics, it's a 1% increase. Integrated clinics is a 10%. And then our nursing facilities are a 1% increase. Go ahead and go next slide. Thank you. So just to summarize the DAP requirements for CYE 2022. As you may have noticed, again, if this is your second or third year in the DAP program, these requirements are progressive. And so you'll notice that each year they add on just a little bit more as far as integration and quality goes to meet these DAP requirements, HIE requirements. So there is a component for COVID-19 testing, antibody and immunization codes there to be provided to the HIE, and that is for all provider types. And so again, that may be new even for some of you that have not, or that were in DAP previously. There is also a data quality scope of work requirement added for the IHS 638 providers and integrated clinics. And there is connectivity with SDOH closed loop referral platform or advanced directive registries added for hospital, critical access hospitals, and other hospital provider types. All DAP eligible providers must have a signed HIE participation agreement and DAP letter of intent submitted by April 1st, 2021. So while we recognize that that seems like roughly a little over a month to get that submitted, the sooner you guys can get that in, the better. We are able to plan accordingly as far as our project management and our resources go to be able to meet those DAP milestones with your organization. Go to the next slide. So this graph here, this table shows you the different eligible provider types by the different contract year ends. So it's really helpful in knowing essentially what the provider types have already been required to do for the HIE milestones, and then kind of just a look to what you can expect in the future as well. So again, we're going through today the behavioral health outpatient, the nursing facilities, and the integrated clinics. So if you follow that over to the CYE 2022 column, you can line up essentially with the types of milestones that you're going to have for this year. Okay, so now getting into the letter of intent. Those of you that have not had to do the LOI submission in the past, I know we've had several nursing facilities that have come on board in the last couple of months preparing for the DAP program. We also need you to submit that letter of intent to not only Health Current, but also to Access. So both of those emails are listed here, and that does have to be done by April 1st, 2021. We do have LOI templates located on the Health Current website. We try to make it fairly easy to navigate, and that if you just look where your provider type is, there will be a link directly next to it with the LOI type that needs to be submitted. Okay, go ahead and go to the next slide. All right, so now we kind of get into the meat of it as far as what are the DAP HIE requirements. And again, this is broken down by each of the provider types. We're going to really be focused on the last three columns here with the integrated clinics. We'll just go with that one first. If you have not already signed a participation agreement, we need to get that done as soon as possible, as well as the LOI. And then we need to make sure that you are able to submit COVID-19 codes to us. The lab authorization forms, there are some labs that require an authorization from your organization to be able to submit the results into the HIE. So we just need to make sure that we get that form filled out so that those results can be released. And then of course, access to data, so our portal and alert services, submitting data to the HIE, and then completing that data quality scope of work, and then an initial data quality profile and your final data quality profile. So the integrated clinics, this isn't your first year, so again, those milestones continue to be progressive in integrating and the quality of data being submitted. Now moving over to the behavioral health outpatient, you'll notice here, we've got the participation agreement, the letter of intent, again, those COVID-19 codes, lab authorization, access to our data, and then data exchange. And let's see, nursing facilities. You guys are new to DAP this year, so there's no if in there, but as far as the HIE requirements go, but if we do not already have a participation agreement signed with you, we would need that, the letter of intent, lab authorization, data exchange, and submit data. In the next few slides, we'll kind of go over the milestones in more detail and the timeframes.
Hey, Jamie.
Yep.
There's just a couple questions in the chat that might be helpful to answer right now, because you're mentioning a few of the things now. If the agency already has an LOI, does the agency need another one by 4/1/2022? Do you want to speak to that? Or I
Yes.
can.
Yeah, because I think some of the confusion that I've addressed so far is in other conversations. An LOI is required every year. So while you may have submitted for CYE 2021, make sure that you have one submitted for CYE 2022. If you are one of the few that have already submitted an LOI for CYE 2022, you would not need to send another one. But I think it's always better to be safe than sorry. So if you want to confirm with us, we can make sure that we have everything, that we have it documented.
And the reason for that, just to provide a little more context, is because the LOI basically says that you as an organization are committing to complete the milestones. So Access needs to know that you're committed to the new set of milestones for this year, which are different than the set of milestones for last year. So each year, Access uses that as a proxy to go ahead and start processing the fact that they are going to pay you those incentives on October 1st. So that's why it's important that we get one year over year. The other question is, are lab authorization forms yearly or one time?
It is one time.
Great. And the last question is about the presentation. We will make this presentation available to everyone who is registered for this event afterwards. So sorry for chiming in on those, but since you were covering some of those details, I figured I'd get those answers out while we're going through.
Perfect, thank you. All right, so this table here, this is to go over the Dap Provider Categories. As we mentioned, we are going through the behavioral health, the outpatient clinics, nursing facilities, and integrated clinics today. But if you're interested in the other provider types that are also participating in DAP, this is the full list of those provider types that are currently eligible. Slide. So just to note, as we go through the milestones, for any milestone that includes electronic submission of patient information, the information that is transferred to the HIE must be actual patient data. The transfer of test data does not fulfill the requirements for the HIE component of DAP. And it must include all patient data, including behavioral health and data covered by 42 CFR Part 2. Okay. So we're going to move into the milestones for specifically integrated clinics at this point. So your organization is eligible to participate if you are licensed by ADHS as an outpatient treatment center, which provides both behavioral health services and physical health services. And the behavioral health services must be utilized at least 40%. And that'll get you to that 1% increase. So your first milestone is, again, no later than April 1st. The clinic must have an LOI in place, as well as the participation agreement. If you participated last year, we just need the LOI. If you participated in the HIE, I should say. And so you will agree as part of this LOI to achieve the following milestones by the specified dates, or maintain participation in the milestone activities if they have already been achieved. So if you've already met some of these milestones last year, we just need that to continue throughout this year as well. If it is your first year as an integrated clinic, then you must have a participation agreement signed no later than August 1st of 2021. Milestone 2. No later than April 1st, the clinic must electronically submit patient identifiable information to the production environment of the qualifying HIE organization, including both a registration event and an encounter summary, as well as specifically seriously mentally ill data elements. If the clinic is in the process of integrating a new practice management and/or electronic health record, or if it's the clinic's first year in the DAP HIE initiative, then it must meet this milestone no later than November 1st, 2021. So again, just continue to keep the progressive milestones in your mind, that these timelines are a little bit more condensed than if you started in the first year. So milestone 3, no later than April 1st, 2021, the clinic must have actively accessed and continue to access on an ongoing basis patient health information via qualifying HIE, utilizing one or more HIE services, essentially the portal or receiving alerts and notifications, or an interface that delivers patient data into the clinic's EHR. If this is your first year in DAP, then you must meet this milestone no later than January 1st, 2022. Next slide. So again, integrated clinics, milestone 4, no later than May 1st, 2021, or by the clinic's go live date for new data suppliers, or within 30 days of initiating that respective COVID-19 related services for current data suppliers, the clinic must complete the following COVID-19 related milestones, if applicable. Related to COVID-19 testing services, submit all COVID-19 lab test codes and the associated LOINC codes to the qualifying HIE to ensure proper processing of lab results. The next bullet, related to COVID-19 antibody testing services, submit all COVID-19 antibody test codes and the associated LOINC codes to the HIE. Related to COVID-19 immunization services, submit all COVID-19 immunization codes and associated CDC recognized code sets to the HIE as well. Next slide. Milestone 5 for integrated clinics, no later than May 1st, 2021. Clinics that utilize external reference labs for any lab result processing must submit necessary provider authorization forms to the HIE. This is going back to my earlier point and making sure that those lab results are able to get released into the HIE and having that authorization form on file. And then milestone 6, no later than November 1st, 2021. The clinic must approve and authorize a formal scope of work to initiate and complete a data quality improvement effort, as defined by the HIE and in collaboration with a qualifying HIE organization. And then milestone 7, no later than January 1st, 2022, the clinic must complete the initial data quality profile with the HIE. And in milestone 8, no later than May 1st, 2022, the clinic must complete the final data quality profile with a qualifying HIE. All right, so again, as I mentioned earlier, integrated clinics, you would be able to receive a 10% increase for select physical health services for the date of service in CYE 2022. Physical health services which qualify for the increase include evaluation and management codes, vaccine administration codes, and a global obstetric code. There is an attachment, C, of the preliminary notice for the specific list of codes which are proposed to increase for purposes of DAP. Okay, we're going to get into the behavioral health outpatient clinics. Real quick, I'll just see, were there any questions in the chat box before we leave integrated clinics?
There was a question if a company has both integrated clinics and behavioral health outpatient type 77, should we submit a separate LOI for each?
Yes, so I would submit a separate LOI for each, as well as in that LOI template, you will have an area if you have multiple sites that are also the different types, either 77 or ICs, we would want you to indicate that along with the access ID as well. All right, moving into behavioral health outpatient clinics, type 77s. So eligibility for the DAP program, if you are a type 77, you are eligible for this, for the DAP program if you're licensed by Arizona Department of Health as behavioral health outpatient clinics, certified for behavioral health T19, and has signed a provider agreement with Access. So your first milestone for this year, again, this is the second year that there's been an HIE requirement for the behavioral health outpatient clinics. So milestone 1, no later than April 1st, 2021, the clinic must have in place an active participant agreement with a qualifying, with the HIE, and submit an LOI to Access and the HIE, in which you agree to achieve the following milestones or maintain those milestones if you've previously participated. So if it is your first year in the DAP initiative with the HIE requirements, then you would need to sign a participation agreement no later than August 1st, 2021. Next slide. Milestone 2. No later than April 1st, 2021, the clinic must have actively accessed and continue to access on an ongoing basis patient health information, essentially using our HIE portal, the alerts and clinical notifications, or again, an interface that delivers patient data into the clinic's EHR. Now, if this is your first year participating in DAP as a behavioral health outpatient clinic, you have until January 1st, 2022 to meet that requirement. Next slide. Okay, milestone 3. No later than May 1st, 2021, clinics that utilize external reference labs, again, going back to having that, that authorization form filled out, allowing the lab results to flow into the HIE, that form, that authorization form would need to be completed by May 1st, 2021. And then milestone 4, no later than October 1st, 2021, the facility must approve and authorize a formal scope of work with the HIE to develop and implement the data exchange necessary to support transmission of data elements described in the next milestone, in milestone 5. So that piece is new. Go ahead, you can go to the next slide. In Milestone 5, no later than April 1st, 2022, the clinic must electronically submit actual patient identifiable information to the production environment of the HIE, including both a registration event and an encounter summary, as well as SMI data elements defined by the HIE. So once you become a participant, you will have an account manager, and the account manager will help walk through all of these requirements with you and making sure that we're able to assist in meeting those milestones. Go ahead and go to the next slide. And then milestone 6, by the clinic's go live date for new data suppliers or within 30 days of initiating the respective COVID-19 related services for current data suppliers, the clinic must complete the following COVID-19 related milestones if they are applicable. And so this is, again, submitting any testing services, lab test codes, and associated link codes to the HIE, as well as any antibody testing and antibody testing codes and associated link codes submitted to the HIE. And then lastly, your immunization services. So any immunization codes and associated CDC recognized code sets to the HIE as well. Okay, again, I'm just going to pause real quick in case there were any specific behavioral health questions that came across real quick.
There is one that says, what if your clinic will be 77 at the time of the LOI, that will be an integrated clinic a month later? Do we send an updated LOI? I don't know if you even know the answer to that or if we need to check with Access.
Yeah, so my recommendation would be you can submit the LOI, but you definitely want to reach out to Access and determine what the best process is going to be. The fact that you made an attempt to submit an LOI is always favored.
Yeah, so we should probably double check with Access on that one to make sure that we know how that's going to be handled. And we can also help coordinate with anybody who's in that position so that we know how it's supposed to work and you know as well. And then somebody was asking, what was milestone 4? Can you show that again? I don't know if you can flip back to milestone 4.
Yep,
we're going to actually go ahead.
This was just to approve and authorize a formal scope of work with the HIE.
And that's a formal scope of work to complete the actual interface of data. So typically we use that process of a scope of work to set expectations between us, our team, your team, and your vendor's team, just to make sure that we're all on the same page. We know the timeline, we know what everybody needs to get done, so we can keep you on track with hitting the data submission requirements. Okay, let's go through nursing facilities. We've still got a lot of slides, so we just need to get through these so we can, but it's good we're taking questions as we go.
So nursing facilities, this is provider type 22. You would also be eligible for that DAP increase under the following criteria. No later than April 1st, 2021, the nursing facility must have in place an active participation agreement with the HIE and submit an LOI to Access and the HIE. So I know we have been working with a large number of nursing facilities. If you've already put a participation agreement in place with Health Current, congratulations, you've got one requirement down. All right, next slide. Milestone 2, no later than May 1st, 2021. Facilities that utilize external reference labs must complete the necessary provider authorization form to be able to submit those lab results into the HIE. Next slide. Milestone 3, no later than October 1st, 2021, the facility must approve and authorize a formal scope of work with the HIE to implement the data exchange necessary to support transmission of certain data elements. Required data elements will be developed by the HIE in collaboration with Arizona Healthcare Association by May 1st, 2021. So be on the lookout for that as well. And then in milestone 4, no later than April 1st, 2022, the nursing facility must electronically submit actual patient identifiable information to the production environment of the HIE, inclusive of the data elements required by the qualifying HIE organization in milestone 3. And milestone 5, going back to the COVID-19 submissions, once integrated, you would want to submit your testing services, as your COVID-19 lab test codes, low codes, antibody testing, antibody test codes, immunization services, immunization codes, and associated CDC recognized code set to the HIE by the go live date for new data suppliers or within 30 days of initiating the respective COVID-19 related services for current data suppliers. Next slide. The DAP percentage is awarded to the nursing facility. So for example, if there is an ownership change with the facility and it occurs during CYE 2022, the DAP percentage will stick with the new provider ID for that facility. Next slide. Okay, I'm going to hand it back to Melissa for data quality strategy and DAP.
Great, thank you. So this first slide is one that Jamie already showed earlier in the presentation. But really this section is going to describe for you how we handle data quality related milestones under the DAP program. This is the addendum to the attachment F and the DAP policy that we've actually had in place for several years, where it shows you how by provider type, the idea is that over time, Medicaid providers progress in their connectivity with and use of HIE services. And after they have actually started submitting data to the HIE, we go through a process to prepare them to do data quality work. So you can see, as we're looking at CYE 2022, data quality previously only applied to hospitals, but in CYE 2022, it starts to apply to clinics and integrated clinics, and actually we're really just doing data prep this year for integrated clinics, and then going forward it's going to apply to more entities like the behavioral health outpatient and the nursing facilities. So if we can go to the next slide. Data quality is actually one of the 4 key pillars of our Health Current strategic business plan. So we have a formal data quality strategy, and the intent with this being one of the main pillars that we focus on as an organization is the value of our services to your organizations increases when we have complete and consistent data flowing into the HIE, and there can be an assumption on behalf of the data users that there is complete and consistent and comprehensive data flowing, and that it's not apples and oranges. So we really have to get this high quality patient health information, we really need to partner with and actively engage with you all as our data sources so that we can apply local and national standards to the data that's flowing in and ensure that completeness and consistency of the data that's being exchanged. So that's just a precursor as to why we're doing this. I can tell you, and you can go ahead and flip to the next slide, Christine, that this has paid off dividends. And I'll tell you a little more about what we've done with the hospitals and how it really has improved the data that's flowing through to the entire community. So in the construct of the data quality milestones, which are part of the DAP program, there's this construct of a data quality profile. So a Health Current data quality profile is an analysis of the completeness, the standardization of the data that is sent from the participant to the HIE. So we actually extract data that any data source sends to the HIE for a time period, and we analyze that data to see if it's in the right segments of the messages, if it's what percentage of time it's there versus not there. Is it according to national standards? Those types of things that ensures that this system to system exchange is processing the data consistently so that the outcome on the other end, again, the use of the data through our various services is of higher quality. So the data quality profile is produced, and it is an analysis of the completeness and the standardization of the data that flows from a participant to the HIE. And the purpose is to identify and close or improve any gaps that exist. So we identify, before we run a data quality profile, obviously, we have to identify what are the areas of the data that's being sent from a participant to the HIE that we want to analyze. So we have to determine a set of data elements that will be measured and by the type of participant. So the only set of participants we've done this with so far is hospitals. And I'm going to show you how their data quality profiles were done and what they look like. But the data that we use to measure for consistency on hospitals might be different than what we want to ensure consistency in the integrated clinic space or in the behavioral health outpatient space. And then we give that data quality profile once it's generated. We provide it to each participant. So you will get a copy of your personalized data quality profile for your organization. So you know how your data submission, how your data, when it's analyzed, compares to what we're looking at as a standard and what we're looking to improve upon. And then we work with you and with your vendor to make changes in the interface, to make changes in terms of how data is captured, or anything that's needed in the whole process from capturing data to integrating it in your EHR and sending it over to the HIE. You know, sometimes it's a minor adjustment on the interface that maps data to a different segment of the message that comes into us to make sure it's coming in the right location. And sometimes it's workflow related. So really the idea is generating these data quality profiles, sending them to participants, and using them as a way to get higher quality data across the board. And what we do is we actually measure data quality improvements by comparing a baseline period, which is typically July of one year, to a final period, which is typically March of the following year. Sometimes we might have changes and we can run interim reports on data so you can see how you're doing in that interim period, but typically it's a July to March comparison. Let's go to the next slide. When do data quality related DAP incentives apply? We actually, this year, integrated clinics will do the data prep phase of data quality. So we actually will set some standards for integrated clinics this year and start running data quality profiles for integrated clinics with the anticipation that next year's DAP policy will actually, a component of what you have to meet in order to receive the incentive is the improvement that's being proposed. So we have to work with you in advance to understand what your data looks like this July and work with you through the balance of the year to make sure you're hitting the improvements that the community and the Health Current Board are approving, and then that you've met those improvements by March of next year. So for integrated clinics, it's anticipated that the CYE 2023 DAP incentive will be based on those data quality measures between July of this year and March of next year. Next slide. For behavioral health outpatient clinics, this year we are focusing on the actual submission of data. So it would be CYE 2023 when we would actually include a data quality improvement plan and we would start looking at creating data quality profiles. And then it wouldn't be until CYE 2024 when the incentives are actually paid on the data, on meeting the data quality improvements. And then similarly for nursing facilities, this year is focused on getting the data into the HIE, and in CYE 2023, the nursing facilities could include the development of the data quality improvement plan, and then CYE 2024 would be when nursing facilities are potentially paid on actually meeting those data quality improvements. Next slide. So I've alluded to this, but I want to make sure everybody knows that we have a very comprehensive process in terms of how we actually develop data quality metrics. We don't develop these in a vacuum or in a closed room. We develop them in collaboration with the community. We actually start at the combination of our Data Governance Council and our Clinical Advisory Council, and we get input from participants to say, what are the areas where we can see the biggest return on investment if we see improvement in completeness and consistency of data coming into the HIE? For example, we focused on ADT completeness for hospitals to support our HIE alerts. Then our team drafts recommended HIE data quality standards for each provider type. We actually have the Data Governance Council approve those recommended data quality standards. We let our board know what they are, and then we go through an additional step to actually let the community that's going to be impacted by this be aware of what we're proposing and receive any feedback. Because if we're way off base and it's something that, you know, as a whole community of integrated clinics really can't be changed for 2 years because it's integrally tied into workflows that are difficult to adjust, we need that feedback. But hopefully by that point, we've gone through enough iterations of community discussions that we've identified those things and there's general support. And then we actually have a final draft. It's approved by our board and it's provided to access as a recommendation for what goes into the next step policy. And I've got to speed through here. So in the current rule this year, the only facilities that are actually going to be paid based on data quality improvements are still the hospitals. But if you want to get an idea of what the hospital requirements are, that is in attachment A and B to the DAP policy. And we can go on to the next slide. This is an example of what the data quality profile for ADTs would look like for the hospitals. So for the first and second year of the hospitals, we have focused on completeness of their admission, discharge, and transfer data messages that come into the ADT. So we're looking at completeness of, for instance, patient demographic information, completeness of the type of visit it is, completeness of a patient class, other things that come in the ADT message that aren't always complete. And you can see here, we're looking for a 10% improvement during that improvement time or hitting a maximum threshold of 90%. 90% or better meets the mark, or if it's less than that, at least 60% and a 10% improvement. We can go to the next slide. You're not expected to be able to see this spreadsheet, but you can see all the green columns with a little red interspersed in there is we do provide access with reports on how each of the facilities that has a data quality improvement requirement in DAP, how they progress. And it shows, you can see anybody with a red there, this is de-identified, that anybody with a red has not met that milestone over the period. And if you go to the next page, next slide, this is just an example. This is a facility, again, de-identified, that the first column there in the red highlighted section is where they started. The next column is where they ended. So that's a July to a March comparison. You can see that they made no change in that area during that period. So that percentage of DAP, which for hospitals is 0.5% out of a total 2.5%, that hospital you can see along the lines might have other green areas, but they likely are docked 0.5% of the total potential 2.5% incentive. So this is how we report the information to access. Next slide. All right, so I'm going to let Jamie, I think, go through these last points. I think we should kind of skim through this, Jamie, just to make sure we've got time for Q&A. But this section really talks about, for each of the milestones Jamie covered earlier, what the deadlines are, what the roles and responsibilities, what our team will do in support of your organization, and what we expect you to do.
Thanks, Melissa. So as we mentioned, provider types are progressive over time, and the HIE milestones that are referenced in the CYE 2022 DAP preliminary public notice, these slides provide just the description and the respective roles, again, as Melissa mentioned, between Health Current and the access participating provider. So review the milestones. If you have questions, certainly reach out to your Health Current account manager if you're an active HIE participant. If you are not yet an HIE participant, please contact our recruitment team at recruitment@healthcurrent.org, and we can let you know what the next steps are to getting you signed up as a participant. Next slide. So going through the roles and responsibilities and executing a participation agreement, again, make contact with us. We are trying to do as much outreach as we possibly can to the eligible provider types, but certainly if you can reach out to us first, that would be helpful. You will want to return the agreement to Health Current by March 28th to ensure that we were able to fully execute the agreement by April 1st, 2021 deadline. And then from Health Current's perspective, we will also execute this agreement and get an account manager assigned to you to begin your project. And just as a side note, when you're looking at that participation agreement, we rarely change the participation agreement. I would say almost never, due to the fact that the agreement has interconnecting requirements for all of the HIE participants. We do have over 850 organizations that have currently signed the agreement without changes. Okay, next slide. So for milestones, to approve and authorize that data exchange, that scope of work. So as a participant, you'll want to discuss with your health current account manager and essentially determine where you're at currently and what needs to take place to be able to draft that scope of work, and then agree to those project details and timelines so that you can involve vendors and look at the resource assignments for that scope of work. Again, that sign off on that scope of work would be due prior to the deadline of October 1st, 2021. The health current account manager will help develop that scope of work in collaboration with your organization. That scope of work will be based on a standard template that we will include, and timelines and vendors and commitments and resource assignments will be addressed in that template as well. Next slide. When it comes to milestones requiring electronically submitted data, the participant will be responsible, along with any vendor partners, to complete the activities related to the interface development and ADT data submission. It is important for the participant to stay engaged throughout this process. We certainly are there to help you, but we need your engagement as well to meet those DAP deadlines. And from a health current perspective, our account managers will help the participant with the detailed technical specifications and the types of data required for submission to meet each of those milestones. And we will help to, we will have assigned resources to help complete the agreed upon timelines and activities as well. And then milestone to approve and authorize data quality scope of work. Again, working with your health current account manager to review and finalize that standard data quality scope of work and approve that final scope of work as well in advance of the November 1st, 2021 deadline. It is important that if we can get these milestones accomplished sooner rather than later, it is most helpful, as we have many organizations participating in the DAP program. Your health current account manager will help to draft the data quality scope of work based on, again, that standard template. They will review it with you as a participant, revise as needed, and ensure everyone is in agreement to move that forward. Next slide. So complete initial data quality profile. So participant to collaborate with health current on any required activities to complete that initial data quality profile. And then once that data quality profile is received, participant will collaboratively review the gaps identified with health current and develop a work plan to address those gaps. And so health current account manager will utilize those data sets to create that initial data quality profile, as well as share that profile with your organization and discuss any gaps in the data segments that that you guys can address to work to close those identified gaps. Next slide. And then complete final data quality profile. So work with health current to mitigate issues and reduce data gaps. Work with your health current account manager to complete that data quality scope of work by supporting health current's production of the final data quality profile. From a health current's perspective, we will help you complete the activities outlined in the data quality scope of work, assign resources agreed upon in that scope of work, and the timelines and activities to ensure that you meet that May 1st, 2022 deadline. And then health current will also submit initial and final data quality profile results to Access for calculation of the DAP incentives. Now, for the milestones related to accessing the HIE data, so the participant will want to determine what services your organization is interested and would like to implement to meet that milestone. Again, we mentioned that there are a couple of options there in regards to the alerts and then portal access. You will also have to implement the patient rights process, and that can be overviewed with your account manager, or if you're not yet a participant, then recruitment would review that process with you as well. But it is to be compliant with Arizona's Health Information Organization statute and inform patients of their rights. It is important for the participant to stay engaged throughout this entire process so that we can meet these DAP deadlines. From Health Current's perspective, we will provide information to your organization around the different types of data access and determine what's going to work best for you. And we will help you to implement that patient rights process. And we will work on resources and timelines to ensure that you meet the data access requirement for DAP. Next slide. All right, now we're at the questions section. I do appreciate the questions that came throughout. I think it's kind of helpful sometimes when we were able to answer a few here and there. But if you have additional questions that we've not been able to yet address, please enter those in the chat box. Or if you would like to ask them verbally, you can always raise your hand and we can answer those as well.
Sorry about that. I was on mute. There are a couple questions that are in the chat. The first one is, if someone's clinic is exclusively telehealth, are they qualified for the DAP program? My understanding is, and Jamie, chime in if you disagree, that as long as you are a registered access provider serving Medicaid patients in one of the provider qualification categories that is covered by DAP, then there's not a distinction about how you provide the services, whether it's in person or telehealth. So you would be qualified. Do you agree with that, Jamie?
Yep, I do.
Okay. The next one is this thought to be mandatory in the future? I really probably can't speak on behalf of Access as to what they might require in the future. Certainly, Access has a variety of strategies that they encourage connectivity with the HIE. DAP is one of them. We also have what we call our HIE onboarding program, which is funded by Access, that provides additional financial support for bidirectional connectivity to the HIE. So that actually can be in addition to the DAP incentive. So that's available. We've aligned HIE requirements with Access's targeted investments program, and Access health plans have certain contractual requirements actually to participate with the HIE. So I would say this has been an evolution of more and more support and encouragement for connectivity to the HIE, but I can't really speak to if there's any plans to make it mandatory in the future. Does our company pay the account manager if we choose to sign up? Good news for everybody who is on the call today. Unless you are a hospital or a health plan, there are no fees to participate with the HIE. So they actually, you don't have any fees to sign up with our organization. We require that you sign a data sharing agreement. That's the same data sharing agreement against all 850 plus entities that participate with the HIE. But at this point in time, there are no fees for services. It is possible that that financial model could change in the future, but we have no intent at this point or no plans to adjust it. We just continue to evolve as an organization, and certainly we would have plenty of notice in advance if anything in that area changed in the future. So hopefully that answers that question. How do we find out who our health current account manager is if we choose to sign up?
If you're not already a current participant, an account manager will be assigned to you once we have executed the participation agreement.
And this one says their account manager has changed a few times, and we haven't heard from theirs in a bit. So is that something that, Jamie, you can get a participant connected to the right person on our team?
Absolutely. And if you want to just go ahead and use the email address that's on screen there, the recruitment@healthcurrent.org, that would be helpful as well, and we can follow up after the call.
Okay. The next question is, what will the role of the health plans be in the coordination, use, and sharing of data through their interface with Health Current? I'm going to try and Troy, assume what you're referring to, but if you want to raise your hand, we can get you off mute and just make sure I'm answering your question correctly. All the Access MCOs are participants in the HIE. Today, they are primarily data users of the HIE, so they are able to access the patient records of their Medicaid members. And they do that through the same types of services that you all have as providers, whether that's real-time alerts about admissions or discharges, whether or not that's other clinical information that helps them analyze, quality improvement, whether that helps them look at care coordination and how as a health plan to have better care management and case management services for their members. All of those types of things are covered in our permitted use policy that describes how health plans can use HIE data. I will note that our board approved a claims data acquisition strategy at the end of last year. So our intent is to finalize the process for implementation of that strategy throughout 2021. And then we will be bringing in initially Medicaid claims and hopefully broader claims into the HIE and using the encounter information in claims to fill clinical gaps of the information that we have on any given patient. So that will just make data more robust through the HIE, and that's how health plans in the future will have additional interfaces with us. And there's an additional note, in addition to contacting Jamie, if you're not sure who your account manager is, Peter Stankin is our interim senior manager over the account management team. So he did put his email information in the chat box, and you can contact him directly and he can direct you to the right person on his team to make sure you get connected to the right account manager. I think I got all the questions. If anybody else has any more, please enter them in the chat box. We've got 1 more minute. Otherwise, feel free to reach out to our recruitment team, reach out to the folks whose emails are in the chat chat box here, and we are happy to answer any other questions one-on-one. We're looking forward to continuing to work with your organizations and make sure that you qualify and you can achieve these additional incentives. And if you're not part of any of our other incentive programs and you're interested in whether or not you qualify, our team can answer those for you as well. So thank you everyone for your participation today. We really appreciate it. And we will look forward to talking with you more soon and get those LOIs in as soon as you can. Thank you and have a great afternoon.